In this documentary, we will be covering Naruto Otawa. His virtuoso skills for AllON4 treatment enables to create teeth and gingiva for people who have lost their own teeth. My implants failed at other dental clinics. I was refused by my dentist to do implant treatments. My teeth are in bad shape. Is denture the only solution for me? His clinic accepts these kind of patients who were declined to do dental implant treatments.
It was a life-changing experience.
I was saved by Dr. Otawa.
It's been a while since I enjoyed talking.
I can finally eat whatever I want without any worries. I am relieved to get this treatment.
This is season 1 of documentary of Naruto Otawa. This coverage has started from preparation for the operation. Usually, TV camera does not show the preparation of the treatment. It seems like the tools and preparation is little too much for a dental implant treatment. But later on, we will know why all this was necessary. The dental surgeon who will perform the surgery is Naruto Otawa. We asked him few questions before the surgery.
Are these the data and pictures of the patient for today's treatment?
Yes. Well, I should have checked them a while ago, but you know, I can't do it without forcing myself into doing so. I am planning which surgical method to choose. My surgery aims for predictable harmony. Usually, my treatment is just following the simulation step by step.
Right.
So, it's like the surgery is already started the moment I start simulating on the computer.
Do you still get nervous no matter how many times you perform this treatment?
Not at all.
In fact, I get excited when the case is difficult. Like, yeah, I'm going to do this.
Haha, I get it.
Yeah, I really get excited like, yay, finally it's a difficult one.
We thought the atmosphere before the operation seemed to be tense, but Naruto was used to it. Naruto is a specialist of AllON4. AllON4 is a dental implant treatment method where the upper and/or lower set of teeth are replaced with just 4 implants. These 4 implants act as a support mechanism for the placement of a new set of fixed teeth. The patient will be able to get new set of teeth and allowed to eat after the surgery, which is why AllON4 is gaining popularity around the globe.
So, let me hear about today's patient. What was the case with her?
The patient received an implant treatment at other dental clinic, but it didn't go well. The implant became loose, and it was giving her difficulty. Since this is the patient's last year working, he wants to redo her dental implants before retiring from his job.
I see. Just like you told me earlier, there are many patients with different backgrounds.
That's right. Each person has their own story.
So, what is the estimated time for the treatment?
I'd say about 2 to 2.5 hours. Probably 2.5 hours.
Naruto headed to the operation room.
Good morning. How are you feeling today?
The operation has started from inducting the anesthesia, followed by extraction of the remaining teeth. We were told that it was a dental implant treatment, but it was far more than ordinary dental implant treatment. It was like we were watching a surgery at a hospital. Our crew had lost our words watching the surgery, and just kept the camera rolling. The treatment seemed to kept going smoothly. An old dental implant came out of the patient's mouth. It seems that this was the dental implant that did not go well at the previous dental clinic.
The patient received dental implant treatment, but it did not go well. Some implant had to be removed and the patient was declined for another implant treatment.
I see, so the patient's wishes were rejected at other dental clinic.
Yes. So these kind of cases that were declined at other clinics or implant failure makes me feel to do my best.
And outside of the operation room, there was a woman who was silently watching the whole process of the surgery.
My husband had been going to another dental clinic, but the implant didn't go well, so he decided to go to another dental clinic.
The person who is getting the treatment is her husband. The two decided to get a new implant treatment, entrusting Naruto for the beginning of their new life.
After meeting Dr. Otawa, it made my husband, and I think that he could be trusted.
I see. Do you have any wishes for your husband after receiving the treatment?
Yes, I would like my husband not to worry about what to eat and enjoy every day.
Naruto's clinic seems to be filled with patients with many problems, such as those who were declined to do implant treatment at other clinic, or those with failed implants. He could be referred as life contractor. Halfway through the treatment has finished. It has been 1.5 hours. Next to the operation room, there is a room to monitor the treatment with live coverage under patient's permission.
That incision will be sewn together there.
There are dentists from other clinics and even residents from all over Japan to see Naruto's treatment.
What is the most difficult point of this treatment?
Difficult? I'd say you have to literally know everything. Of course, you have to be able to perform the surgical procedure, but you are also required to have an in-depth knowledge of the principles of occlusion and other fields of dentistry. I'd eventually want to be able to do All-on-4 by myself, but I am still in the course of learning.
What is so amazing about Dr. Otawa?
I'd say he is very talented. He seems to be talking from his gut feeling, but you can understand that he's got his own theory based on his experience and deep knowledge.
The resident who was there to watch the treatment.
This All-on-4 treatment is a rare treatment that can't be seen in other dental clinics, so it was very interesting.
I see, so you are here today to learn Dr. Otawa's technique.
Yes, that's right.
It is said to be difficult even for specialists to perform AllOn4. As you can see here, you can create an ideal gingiva and teeth. It seems like there will be no more problem with dentures. But, how did Naruto master the technique of AllOn4, and what kind of life did he went through? Naruto was born on October 2nd, 1982 in Fukuoka.
When I was young, for example, my mother's hairdryer broke. Then I would use a driver to dismantle the hairdryer and fix the broken part and later on rebuild it.
Naruto was precocious and a little different from others. He had an older sibling that decided not to succeed their father's business. That was his first turning point.
Not this building, but the building next door was renovated by my father long time ago. I was never told to become a dentist, but I was feeling pressure, like I have to keep this legacy going and pass the torch. So that was my first turning point.
Right, in addition to that, your older sibling did not become a dentist.
If my brother was a dentist, then I would have chosen a different occupation.
Then, Naruto entered Kyushu University to study dentistry.
I was doing a lot, like modifying used cars.
Wow, I never had people who modded cars around me. Like really, modifying cars?
Yes, modifying cars.
Wow.
Naruto then enrolled in graduate school, and there he conducted research on transplanting artificial bone.
Dentists were struggling for people with not enough bone. So, there were two groups of dentists. Most of dentists chose to create bone. I was also on that side, and wondering how to create precise bone. My research focused on using computer and 3D printer for creating precise bone, since no one was doing it. Then my research theme received Chancellor Award of Kyushu University.
Wow, now you're just bragging.
I didn't want to brag, so I was hesitant to say, but I was interviewed for a newspaper article.
Wow, that's amazing.
Naruto's second turning point. His research theme of artificial bone generation received Chancellor Award, but at his new workplace, he met AllOn4 treatment, which was the opposite of creating bone. There, Naruto was confused.
I was very disgusted at AllOn4. Of course, I knew about AllOn4, like removing all teeth, and what? Restoring with only 4 implants. And I was like, why wouldn't you save some teeth for future? But what I saw at my new workplace was patients who had done AllOn4 10 to 15 years ago with no problem. I was anti-AllOn4, but in reality, there were cases with good results. And then, I thought that by using my knowledge of computer and 3D printer to AllOn4, I could change the world. That was my turning point.
What is AllOn4 to you?
I'd say destiny. It is technically difficult to treat one jaw with only 4 implants, but I realized that I was able to do it, so I had to share this technique to those who are in need of this treatment.
and there was one lady that we were interested in upon our coverage. She has been coming from Tokyo to Fukuoka to get the treatment at Naruto's clinic.
We heard that you have came from Tokyo today.
Yes, that's right. I received an implant treatment at different clinic. But it didn't go well. I was seeking for help and found out about Dr. Otawa's clinic in Fukuoka. I would rather say Dr. Otawa saved me. And I got a much beautiful teeth. When I first talked with Dr. Otawa over the phone, he tried to make me calm, and it made me relieved. Since my treatment didn't go well in Tokyo, I think that the doctor or dentist that performs the surgery is important for AllON4. If it hadn't been for Naruto's turning point, the couple and the lady from Tokyo would still be suffering. It could be said that this was Naruto's greatest turning point.
And Season 1 enters the latter half of the coverage. We were able to talk to the patients who received the treatment at the beginning half of the documentary.
Please open. Okay, then bite firmly.
Let me explain why Naruto is said to be genius. Please look at these two pictures. The left picture is the normal AllON4. The right is the AllON4 with zygomatic implants. Zygomatic implant is long compared to normal implants and placed in very deep position. This is why this treatment is said to be difficult. Even the professionals are amazed by his technique. This person who is receiving medical examination received Naruto's treatment 6 months ago. Before coming to Naruto's clinic, this person has been going to different clinic for 12 years, but it didn't go well and decided to see Naruto.
I received my first dental implant treatment 12 years ago. 12 or 13 years ago. Well, the previous implants treatments I had was like replacing one implant for one teeth. Along with that, I had a big partial denture. I had a lot of difficulties and wanted to redo the treatment. Firstly, he has learned the zygomatic implant treatment. That made me wanted to trust him. He is still young, but very confident and humble at the same time.
The most memorable people during the course of 6 months coverage was that wife who was watching the whole process of her husband's surgery.
My husband had been going to another dental clinic. But the implant didn't go well, so he decided to go to another dental clinic.
The person who is getting the treatment is her husband. The two decided to get a new implant treatment, entrusting Naruto for the beginning of their new life.
After meeting Dr. Otawa, it made my husband, and I think that he could be trusted.
I see.
Her husband has retired from his job, and in order to start their second life, they have decided to receive the treatment. Yes, Naruto accepts patients who were turned down at other clinics. It is easy to say, but during the course of filming the documentary, we were amazed of Naruto accepting those kind of patients and facing the treatment. Our crew met the couple for the first time after the surgery. They were kind, charming, and even refreshing. After the last documentary, our crew have decided to film the follow-up of this couple. Today, the patient is getting the final prosthesis.
Hello. How are you doing? Now we're going to check the actual occlusion of the final prosthesis.
Okay.
And Naruto is on to the last adjustment. The adjustment have finished.
Please check the mirror to see if everything is fine.
Okay.
Those teeth are beautiful.
The colors are just as I wanted it to be.
Were you particular about the color of the teeth?
Well, yeah, kind of. I didn't want it to be too white.
The patient had trouble with his teeth for 12 to 13 years. In addition to that, the implant treatment at other clinic didn't go well. Today is the day to say goodbye to those troubles. We asked the patient.
At first, I was only going to do the upper jaw. For the bottom, I was thinking of adding 2 normal implants. But I was told that if I am feeling pain in the bottom jaw, then I should do both jaws. Receiving those advices from Dr. Otawa, I decided to do both jaws.
How do you feel after doing both jaws?
I am confident to say that I made the right decision. I chose the right clinic to redo my implants. Crispy fried chicken.
Oh, fried chicken.
I usually eat fried chicken, even crispy ones. I usually eat meat. In fact, I had meat for the dinner last night, but I had tender steak, so it was a little expensive.
Many who receive this treatment say that they would like to eat meat.
I agree with that. Now I can laugh without worrying about what others think about my teeth. So I guess I'll start practicing karaoke since I'm not good at singing.
That sounds great. Isn't it fun to have a new goal?
I can feel that I'll have a bright future waiting for me.
The patient seemed very pleasant, with much more smile than before. Even our filming crew became happy with the outcome. And how do you feel after getting the final prosthesis?
I feel very happy.
I thought so.
We don't have to frequently go to dental clinic anymore, so we could travel to far places.
If there are still treatments unfinished, it is difficult to travel.
When you're worried about your teeth, you're like constantly worried, like this teeth is this teeth is that. But after AllON4 and zygomatic implant, we don't talk about teeth anymore.
It really has gotten better, I'd say.
Yes, we don't talk about teeth anymore. I am going to a reunion at Tokyo next month, so I am having my husband come with me.
That's great news. This is all because the teeth is fixed, I'd say.
Please enjoy eating.
Thank you very much, doctor.
Lastly, we asked Naruto. That patient had been receiving dental implant treatment for 12 years, and he said that they were very happy to be able to receive their treatment at your clinic. Everybody I interview say that they were very happy with the result of the treatment.
The patients decide whether the treatment was a success or not, so it is not for us to decide. But if the patients are happy with the outcome of the treatment, then I am very happy too. Many patients say that their previous treatment at other clinic failed, so I think that it is our duty to solve the problem.
The patient being released from long-time worries, and dentist who faces problems to help those in need. This seems to be nothing special. But during this half-year coverage, we strongly felt that such common thing is very precious and honorable. If you have trouble with your teeth, we recommend you to visit Dr. Otawa's clinic.
We are the only clinic that can save him.